everybody. While you're waiting for us to start the orientation, please take a moment to look at the slide that's being displayed. We have a couple instructions in there that we'd like you to follow. Check out the chat box for the link to the Jamboard that we're going to be putting in there in just a second or two, and start filling out the Jamboard with your responses to our prompts.
How do you do the background thing? I'm sorry.
Sure. So you should check your email. There were some images that were sent, and if you have them, there should be a little caret next to your video. So mine says stop video, and then there's a caret next to it. And when I click on it, it says choose virtual background. And when I choose virtual background, I add the image from my computer, and then you can add it.
Okay, thank you. I'm sorry.
You're welcome. Thank you. It's a good question.
There were images sent in the email?
Yes, there were images sent in an email yesterday from the dean at 7:51 p.m. to your Lehigh email.
It says the Jamboard, there are too many people viewing the document, so I can't get on it.
We'll take a look.
Same with me.
Maybe we're going to ask our faculty and staff to get out of the Jamboard right now.
I'm sorry, could you repeat how to do the photo background thing one more time?
Yes. On your screen, you should see a mute and a stop video function. And next to the video should be a caret. And if you click on the caret, it'll say choose virtual background.
Okay.
And then you'll need to add the virtual background.
I can add the virtual background, but you can't see my face.
Yeah, I had the same problem.
Yeah, the same thing's kind of happening to me. I don't really know what to do.
Some Macs aren't designed to run the virtual background. If it's an older Mac, it might not work.
So the other thing that helps with your virtual background is you want to make sure you have a lot of light in front of you. So, and the virtual background is also based on depth. So the farther you sit back, the farther it will go away. But if you have a lot of light in front of you, it will also help. You want less light behind you and more light in front of you.
Is it okay? OL meeting. Do you mind repeating how to put on the background?
Is it okay if we just go without a virtual background?
Sure, if you can't get it to work, that's absolutely fine. And if you're done adding your comments to the Jamboard, would you mind exiting out of it so that other people can join? There seems to be a capacity limit. And there are multiple questions in the Jamboard. So at the top, you will page through. So the first question is where you came from, where you call home. And then if you click to the right, tell us a fun fact about yourself. And then the next is what superpower you would want and why. And what skill did you learn when you were young that you still use today?
I keep getting kicked off of the Jamboard.
Same, it's not letting me in either.
Yeah, I can't access it.
I see some people adding. So if you've added and you exit, okay. Okay, so you can continue to do that. We're going to turn it over now to our dean.
Thank you so much, Sherry. Good morning. Welcome to you all, the inaugural class of 2024, and welcome to your first year orientation. My name is Whitney Witt, and I am the inaugural dean of the College of Health. And on behalf of the College of Health staff, faculty team, I want to congratulate you on your achievements. This orientation is meant to be an informative and fun way for us to get to know each other. Today is a monumental day. It marks the opening of the College of Health. This is 5 years in the making, and you were in middle school when we started planning and establishing the College of Health. The College of Health is the first new college to open in the past 50 years at Lehigh University. And you are an amazing and accomplished group of students who were handpicked to be part of the inaugural class. I want to just take a moment and talk about COVID-19 as it's been on our minds, all of our minds. The impact of COVID-19 has really, as you know, transformed our nation and our world. COVID-19 is precisely the kind of challenge that you will have the opportunity to address. Beyond COVID, you'll learn about health data science, epidemiology, community health, and health innovation and technology. Driven by innovation, you will have opportunities for leadership and impact. Along with your coursework, you will work alongside our faculty and partners to engage in influential research, policy, and practice to improve the health and well-being, not only of our local communities, but also nationally and our global communities. And your education and subsequent careers stand to impact the health of millions of people. So I now want to start with a few icebreaker questions for us to get to know each other. Remember, there are no right or wrong answers. This is meant to be fun and even funny way for us to start this journey together. So let's now turn to everyone's responses on the Jamboard to kick this off. So the first one is, where do you call home? And I can see a lot of different places from San Francisco, Hawaii, Pennsylvania, New York, Wisconsin, Zimbabwe. Seeing more coming in right now, Nashville, Tennessee. So really, Illinois, really spanning not only the United States, but also, you know, around the world, over into the African continent. So very diverse group of students who, you know, you all will be getting to know each other very well. So thank you for that. I hope that's helpful for you all to know. And then the orange Post-its represent where the faculty and senior staff are from. So that's something for you all to just absorb and be able to see where we're from. Okay, let's move on to the next Jamboard. Okay, so the question here is to tell us a fact about yourself. So many of you have talked about, you know, some of your activities. I'm hearing some of you that are enjoy band. One of you is a British citizen. Your athletes. One fun fact is that one of you likes to raise ducks. Some of you have studied abroad in Finland, and someone does not like peanut butter. Good to know. Painting and calligraphy. We also have a British citizen, another fun fact. So, and then somebody said that they play softball. They have 3 pet newts. Some of you like to water ski, particularly in Alaska, which is, I want to hear more about that. You enjoy sailing. Some of you know Morse code. You love to run. I am with you. I love to run as well. You enjoy swimming, going to concerts. And you also, it sounds like you also enjoy playing tennis. You love taking photos and walking on trails. So, wow, you guys are amazing. And these are incredible facts about some of the things that you all enjoy to do outside of your time in academics. Okay, so let's move on to the next one. So the next question, and I'm sorry I can't read the post-it. The next question was, what superpower would you want and why? Oh, I love these. Flying, mind reading skills, the ability to reverse time, speaking in all languages, both current and with the dead, to create more time, persuasion, the power of persuasion, the ability to heal, breathing underwater, superpower of being able to teleport yourself. That sounds like something I would like to do. The ability to stop time. I'm also seeing going back in time as something that would be of interest. And someone said every tools that Wonder Woman has, especially the invisible air planet. So that's great. To be immortal. Shape shifting is a superpower someone said they would love to have. So this is great. Oh, moving things in your mind by 5 times. You know, at 5 times the power of movement. So these are great, and many of these superpowers I now want to adopt for myself. So thank you so much for sharing that. These are great and wonderful to hear about the kinds of things that you would like to do. And you know what, we're in the 4th industrial revolution, so we may have the opportunity to do some of these things. So stay tuned on that. Okay, I think we have one final Jamboard question. And this one is about what skill did you learn when you were young and you still use today? So these are great. Someone learned how to cook pasta, to always give your hardest, being a morning person, always being positive, being ambitious, patience, to dream big and make it happen, learning good work ethic, a good sleep schedule. That is a good thing to learn early on. To never give up, and to study smart and but not hard. Another response is balance is key. Some of you said that mom is always right, which is often very true. Learning the difference between what I need and what I want. Staying motivated. The importance of effort. How to make a proper cup of tea. This is great. How to keep calm and carry on. Boy, words to live by today, right? Patience, motivation, taking detailed notes. These are all really, really great takeaways from your early days that I'm sure you'll carry with you as you move forward. Oh, here's some great ones. Writing old-fashioned letters on beautiful papers. I definitely love doing that kind of thing. Okay, so I think we'll need to wrap up this part of the orientation. This has been really fun to hear a little bit more about you, and hopefully you learned more about us. I want to now turn to introducing you to our team. The founding members of the College of Health team comprise a very experienced and talented senior administration team and faculty. First, I am thrilled to introduce you to the inaugural senior staff. Sherry Buss is the Director of Administration for the college, and Jeannie Cassis is the Executive Assistant. And together they bring nearly 40 years of in-depth expertise to the College of Health and to Lehigh University. They have done a fantastic job of keeping the College of Health running, and I fully expect that they will continue to do that. Next, I am delighted to introduce you to our inaugural faculty, who include some of the world's experts in population health. Dr. Hal Skinner, who is the Associate Dean for Research and a faculty member. The Associate Dean is an epidemiologist by training, and he will oversee the research enterprise in the College of Health. So much of what you will be doing in your time here will be to not only take classes, but to also have experiential learning opportunities, and that includes research. So he will be the lead on that. Next, Dr. Fatima Akil. She is an expert in maternal and child health. She is a leader in the development of measures of resilience and personal capital among pregnant women. She will be teaching the Introduction to Population Health course in the fall, so you'll get to know her very well. Next, I'm very pleased to introduce Dr. Hanyuk Choi, who is an environmental epidemiologist whose work focuses on the effect of air pollution on health. And she has conducted some of the most significant studies around the world in the Czech Republic and in China. And she'll be conducting research here in the Lehigh Valley to understand the increased incidence of respiratory illness in our local community. I'm also delighted to introduce Dr. Ed Gomez. He is an internationally renowned political scientist His groundbreaking research focuses on politics and health policy reform. And his forthcoming book is titled Junk Food Politics. This book examines the influence of the junk food industry on health, particularly in Latin America, Asia, and Africa. I'm very happy to introduce you to Tom Mcandrew. He is a nationally recognized biostatistician who works with the Centers for Disease Control to develop novel multi-model ensemble algorithms to forecast the seasonal flu. Most recently, as you can imagine, he's now provides weekly estimates to the CDC to follow and predict the trajectory of the COVID-19 pandemic. I'm very thrilled to introduce you to Dr. Chris Daley. She is a medical anthropologist and an internationally recognized expert in Indigenous health and well-being in Indigenous studies. And she leads major initiatives, including tobacco cessation programs in American Indian communities. And last but not least, Dr. Sean Daley is a cultural anthropologist and an expert in educational programs for the health of Indigenous populations. His work creates an interface between research on the health of Indigenous communities and educational pipelines to develop new scientists in this area with a focus on students from Indigenous communities. So without further ado, I think we can move into the Kahoot session. I'm pleased to now turn this over, and this will give all of you a chance to get to know the College of Health senior staff and faculty.
So while we wait for Professor Mcandrew to load up a slide, I want you to please get your cell phones out and open a web browser and type in kahoot.it. And in the chat, we're going to put a pin, and you will enter that pin, and then you'll all be in the game we're going to play. The pin 711923. Then enter your name. And we'll wait for Professor Mcandrew to tell us when we're ready. Dean Witt, did you want to provide an overview of what we're using the Kahoot for?
Sure, I'd be happy to. So we are using Kahoot as a way to really get to know each other and as a means really to get to know the faculty and staff who you'll be working with. And we are going to have some sample questions that will enable you to, as Sherry mentioned, put some answers into your phone that will then be populated onto these slides. And then it will be a jumping off point for us to talk about different aspects of our careers and for you to get to know a little bit more about our team.
So when you're looking at your phone, you won't see the answers on your phone. You'll just see the colors that match the answers. So we have a couple test questions to get us started. You're quick. So I think everybody has an idea how that works. I hope we have 100% right on this one.
Okay.
Now we're going to hear from Professor Gomez.
Hi, everyone. Welcome to the College of Health. It's so exciting to meet all of you. And thank you for answering the question. I see most of you got it right. I have been working in Brazil. I'm a political scientist that started my career looking at Brazil in comparison to the US in response to AIDS and tuberculosis. I've been working in Brazil since the very beginning of my career, and now recently been doing comparisons to India, China, Indonesia, South Africa on the rise and influence of junk food industries and their impact on the health of children and the poor in these countries. I've also been going to Mexico a lot, doing research there recently. And I'll be seeing some of you on Monday in my class on history of population health. And so wonderful to meet everyone. I look forward to speaking to the rest of you soon.
And that is true. For those of you who don't know, Lehigh was an all-male school originally until it accepted students in the 1970s. So that, but women did have a foothold in establishing the school colors based on the socks that they were wearing. Okay, Professor Sean Daley.
Hello, welcome to everybody. As Sherry just said, I'm Sean Daley. I'm a cultural anthropologist by training. One of the things we're doing here at Lehigh and the College of Health is we are starting an Institute for Indigenous Studies. Currently, our focus is on American Indians and Native peoples of the Americas, but our hope is as we grow the College of Health We want to explore other areas, Africa, Australia, Asia, anywhere in the world there are indigenous peoples. So if you have an interest in indigenous peoples, working with indigenous peoples, there's definitely a couple of us here in the college who have experience with that and would be glad to visit with you and get you started on that path.
All right. Well, hi, everyone. It's so wonderful to see all of you today and start our new College of Health. So I have always been interested in maternal and child health since high school, actually. So a lot of the research when I was in my doctoral program was really focusing on the risks leading to adverse birth outcomes. And so I really wanted to take on a strength-based approach. And so I decided to focus on maternal resilience. And so that's really what I'm building my life's work around, is understanding how some women, despite all of the stressors they deal with throughout their life course, how are they having these positive health outcomes in terms of pregnancy and birth outcomes. So I wanted to learn more about what those resources look like and how we measure those resources, and how these resources look different for different groups of, in different cultural groups, different socioeconomic groups, and different racial ethnic minorities, and how these resources really develop over the life course. So that's really what I do. I'll be teaching all of you in my Intro to Population Health course. I'm very, very excited to see all of you soon next week. Thank you.
Hi, everybody. I'm Hal Skinner. I'm the Associate Dean for Research and an Associate Professor. I'm an epidemiologist by training, and many of you know that the Health Science and Technology, or HST building, will be the College of Health home starting in the fall of next year, 2021. I don't even know where Chandler Ullman is yet, so I look forward to learning that myself. I have been to Williams Hall and the University Center, though. So we're going to learn the map of Lehigh together as we move forward. My work has been starting at the biological end of the spectrum of cell to society. I call myself a molecular epidemiologist. I'm really interested in how biological pathways and the variation within biological pathways influence variation in human health in the population. So most of my work was around the genetic and environmental factors that influence risk and progression for cancer. I've developed a few diagnostic and screening tests for ovarian and prostate cancer, one of which is in commercial development right now. But overall, I consider myself a generalist, and I like to tackle interesting problems as they come up. So that's led me into doing some health services research, helping to develop a measure that the federal government uses to evaluate patient safety in hospitals and determine how much money they pay them at the end of the year. Hospital administrators hate me. And I was also able to work in the private sector at IBM, evaluating some technologies that IBM had developed for decision tools for physicians, oncologists specifically, based on artificial intelligence to decide how best to treat treat their cancer patients. And those tools are in use around the world, and we wanted to see how well they work in different environments, different cultures, overcoming language barriers and differences in clinical practice. So now that I'm here at Lehigh, I'm working on developing research resources, the Population Health Data Warehouse, our artificial intelligence and data visualization lab, and an exciting cohort study that's in the planning stages right now. I look forward to meeting all of you in person when we have the opportunity to do so, and I'm really excited that you're here.
All right, it looks like somehow everybody got that correct. They didn't think I was developing pictures from the 1950s, although I love that fashion era. That's right, I build multi-model ensembles, or sometimes called stacked ensembles, of computational models and of human judgment from experts in the modeling of infectious disease. I use those to forecast seasonal influenza and to forecast coronavirus, something that we're all aware of at the moment. You might see me skulking around population health data science, teaching statistics, and really how to ask questions and answer them using statistical tools. When everybody's back on campus, you might also see me. I'll probably be much more popular then, because I may have my 3 dogs with me, Banjo, Fiddle, and Kazoo.
Hi, everyone. I am so pleased to meet you, and I can't tell you how invigorated I feel to see all your beautiful faces. I have a lot of stories that I want to relay to you, and I'm glad that I have 4 years to do that. Just to briefly introduce myself, I started out as an environmental epidemiologist who essentially makes a connection, ideologically significant connection between very early life exposure to air pollution, before you're born, to, lifelong illnesses starting in childhood, and that's driven by a thought that what you experience in mother's womb actually programs you for wellness and health throughout life. But then I got really, limited by the fact that I was not doing much more than making associations. So I wanted to understand the true causality by looking more at the molecular factors that contribute to such processes. So I focus a lot more now on the molecular factors that mediate the disease development. And I am looking forward to telling you more if you're interested in research, community service, and community building. Thank you.
Hi, everyone. I'm Chris Daley. I want to welcome all of you to the College of Health, and it's awesome to see all of your faces. I know I've communicated via email with some of you. Great to actually see what you look like. And thank you guys so much for taking a chance on a new college in the middle of a pandemic, coming to campus, getting tested for COVID multiple times, wearing masks, all of that. You guys are awesome. And we're here to help you through this and keep you healthy. We are a College of Health after all. So thank you for that. And yes, I do focus on reducing American Indian health and educational disparities. American Indians suffer some of the worst health disparities and educational disparities in this country. And when I see you all in classes over the next 4 years, you'll learn a lot more about that. So welcome.
Well, great job, everyone, in getting that right. So yes, I started my career in public health, working at the Gay Men's Health Crisis in New York City, conducting legal advocacy for people living with HIV and AIDS. And living through the HIV/AIDS pandemic made a significant impression on me and ultimately changed the direction of my career from being a lawyer to being a population health scientist. And there's much to be learned from the HIV/AIDS pandemic and now the global pandemic of COVID-19. I do want to just share with you a little bit about my background and journey before I became the dean of this college. So I started out my training at Johns Hopkins in public health and then went on to Harvard Medical School for my postdoctoral fellowship in pediatric health services research. And then most of my research has actually been on looking at the impact of chronic illness during childhood and on families and siblings, and then also in turn the psychosocial adjustment of children living with health conditions, special health care needs. Then my research kind of shifted upstream in the life course to look at what happens during pregnancy or even before pregnancy that might help us better understand poor birth outcomes, which we know contribute to the increasing incidence of childhood disability. So a lot of the work that I did really focused on those preconception factors that are actually much more powerful in determining adverse outcomes during pregnancy and labor and delivery and in the postpartum period. And then I would just finally add that my work really did sort of span from cell to society. My final work before I became an administrator was looking at how stress gets under the skin. How does racism get under the skin to affect health and birth outcomes? How does the stress of caring for a child with a disability affect the health of the parents and of the siblings? So I started looking at the biological factors that might help explain the associations that we were seeing on a population level. So that's a little bit about me. And I'm really excited for you because you're not going to have to fall into this educational experience or career. You'll be able to start from the very beginning. So many of us on the phone and you know, my colleagues at other universities kind of fell into this career, and you will not have to do that. So I'm a little jealous, but it's been a wonderful journey, and I am so glad you're here. And thank you for the opportunity to share a little bit about myself.
Yes, you guessed it. It's me. My name is Sherry Buss, and I am the Director of Administration. And I know that I've been in your email inbox over the past several months many times. So I am excited that you are finally here. We are launching the college. You are part of this point in history, and I'm really excited to be sharing it with you. So as Director of Administration, along with the rest of the Dean staff, we are located in the STEPS building, Science, Technology, Environmental Policy building. So please come visit us when you're out and about on campus. We are located on the 4th floor. Mind you that we will be working remotely for most of the fall semester, but that doesn't mean we're not available to you. So our contact information is on the College of Health website. You can reach out to us by email. We can set up a time to meet via Zoom. We can talk over the phone. I can come to campus and meet you in person as well. So our faculty offices are also located in the STEPS building. And when you receive your course syllabi from your faculty, they'll let you know where they're located physically, how they can be reached during the fall semester. Again, if they're working remotely, what the best way to contact them is, and also their office hours. So I have been at Lehigh since before you were even born, which is a little bit scary for me, but I did have a son who graduated from Lehigh just a few years ago, so I can help from the parental side of things as well as what you're navigating as a first-year student. There's lots of resources out there, and I know that you've been flooded with information. You have your Griffin as a resource. You have the Dean of Students office. You have registration and academic services. But please know you also have your College of Health team as resources. So we are here for you. Please come to us with your questions. Please try to find answers out on your own first. That's always a good skill to learn. But when you get stuck or you need that guidance, that's what we're here for. And we are very excited to be that resource for you. And lastly, just my little piece of advice for you is don't wait to get involved. There's so many opportunities, and I know it's going to be overwhelming, and especially in light of the COVID restrictions, but just jump in there and start to explore different clubs, different organizations, different ways that you can engage with your Lehigh family. And if you don't like it, then find something else to do. But this is your chance to really expand. So don't hesitate. Just jump all the way in and get started. So I'm really looking forward to being part of your lives for the next 4 years. Thank you.
Sorry about that. Hello, everyone. I'm Jeannie Cassis, and I'm the Executive Assistant in the College of Health, and I am the keeper of your swag, not the bookstore. It is I. I'm so happy that you're here. It's been a long time coming, and I'm looking forward to meeting everybody. My office is located in steps 414, and for those students that are on campus, I'll be sending you out an email so that you can sign up for a time to stop in and pick up your swag. And for those of you who are remote students, I will be reaching out to you in the next couple of days to get your address, and I'll be mailing your swag out to you. I just want to let you know too that I work hand in hand with the dean, so being the keeper of the swag is not my only job. And I too have a student that has graduated, two students actually that have graduated from Lehigh in the past couple of years. So I can help you with some issues that you may be having around that as well. And like Sherry said, there's a lot of resources out on Lehigh's website. They really do a good job getting information to you. But if you're struggling finding something, please don't hesitate to email me. I'm happy to help you, and I'll be available to assist in whatever way I can. Thanks, and have a great semester. Good luck. And again, I'm really happy that you're here.
Wow. Been great getting to know all of you, and I hope you had a nice opportunity to hear from our inaugural senior staff and faculty about their backgrounds. I want to echo what everyone has said. We are so excited to work with you. We are just thrilled that you're here. It's so wonderful to see your faces and hear your voices, and we can't wait to meet you in person someday soon. And I want to conclude with just saying on behalf of the entire College of Health staff and faculty team, I really want to congratulate you on your achievements thus far. And we expect that you continue to grow and learn and take advantage of these amazing opportunities that you will have before you during your 4-year tenure here. This is really the beginning of a wonderful new chapter for you in your academic career, both here within the College of Health and at Lehigh University more broadly. And please know that we're always accessible to you with any questions, concerns, or general support. I also want to just point out that along with the College of Health, please know that there are many resources around campus that might be helpful to you. For example, the Division of Student Affairs, which can help support you in intellectual and personal development. This has been a fantastic orientation, and on behalf of the entire team, I want to welcome you as the inaugural class of 2024 and to the College of Health family. This is one of a kind and groundbreaking college like no one other in the world. This is the first undergraduate program in population health with a focus on innovation. Your education is going to prepare you as the next generation of population health innovators, and you are going to positively influence the health and healthcare for people all around the world. We are so excited to welcome you to the College of Health family, and I just can't thank you enough for choosing Lehigh and choosing the College of Health, and I know you will not be disappointed. So now we would like to turn to doing a group photo. So the students who are comfortable having their photo taken should stay on the call, but certainly understand if you're not comfortable with your photo being taken at this time. This is the time to probably jump off of the call. And we have our colleague, Krista New, in the College of Health conference room in steps 386, who will also be taking some pictures. So without further ado, I'm going to turn it over to Sherry or Krista to get a picture.
Hi, everyone. I think you can hear me now.
Oh, Kurt, can you mute? All right.
Yes,
So Kurt's
yes.
in the background. I'm going to hide the video. I just wanted you to see. This is like behind the scenes. So we have a couple setups here. So before I hide my video, I'll just say we have this nice setup. So what we want is everybody to be kind of in the center of their screen and kind of sit up straight. And then I'll direct you through audio, but I'm going to try it a couple different ways. So we're going to try like 4 frames. And the first one will just be happy, straight, happy, upbeat, right? And then after I do that one, I'll direct you to, I'll do some sort of cheer. And then we'll do a normal one and then another fun one. But you're gonna wanna, when you do the cheer one, it can be thumbs up, it can be like this, just something that looks very celebratory. Think like photo booth, high energy, and hold it a little bit so that you'll be as sharp as possible. And so it's great. I look forward to meeting all of you in person. I'm so excited you're here and that the college is officially beginning. And so without further ado, I will hide myself, but you will still hear me. And then, okay, so we have this to 2 different screens because we can only fit 49 of you in a frame. All right, so get ready for just this nice, happy first day of classes shot. And this will be kind of serious but happy. Okay, ready? I'll count to 3. 1, 2, 3. All right, now for this one, kind of a cheer, high energy, think photo booth. Throw your arms up in the air, jazz hands, wave, thumbs up, ready? 1, 2, 3. The reason I keep doing it is because I'm waiting till it says Kristen who is talking to fade off the screen. Okay, so one more serious one. Now we're all friends. Just look right in that screen, think you're so excited. Ready? 1, 2, 3. And one last one. I'm going to switch screens now to the other group. So let me find this mouse.
But we don't know what group we're in, so we should all.
Yeah, so you should all be high energy. Excellent point. Okay, so this is ready, high energy. Ready, 1, 2, 3, thumbs up. And then one more for fun, relaxed one. Okay, relax your shoulders. Look happy and rested. Okay, ready? 1, 2, 3. We got you. Thank you so much, everyone.
Thank you, Krista.
Thank you, Krista. We really appreciate you spending your time today to capture this wonderful moment in time, which you and Kurt have also been part of the College of Health family and have been with us along the way. So you all will get to know Krista and Kurt as we progress along, and they do a lot of multimedia events and help us with pictures and videos. So they're wonderful partners, and I'm delighted to have you join us today, Krista. So thank you so much. So I wanted to just let you all know sort of where we are going now. We're right at 12 o'clock. And so for those of you who are on campus, you can safely tour the campus, remembering Lehigh's COVID requirements. And for those of you who are remote, this is your chance to take a lunch break. And then following, starting at 1 o'clock, you will have your small group advising sessions arranged by the faculty. So you should have heard from your advisor about how to link in via Zoom and have those advising sessions in a small group session. And some of them may be also a small group session in addition to a one-on-one. So thank you again so much for coming today. And this is going to be the first of many meetings that we'll have together. And I'm just thrilled that you're here. Thank you.